Okay, hello everyone, and thank you for this opportunity to present our research on measurement of heavy metals in donor blood in Canada. Oh, okay, sure. We studied lead, mercury, and cadmium in donor blood, but today, for the sake of time, I just focus on lead. Lead is an irreversible neurotoxicant. This is a poster from CDC about the adverse effect of lead on brain and neural development. There is no known threshold for this effect, so we should limit the exposure to lead to as low as possible. Blood transfusion is being recognized as a source of lead exposure. Probably it's not of concern for adult transfusion, but for premature neonates and very low birth weight infants who receive multiple transfusion, it can become a significant source of lead exposure if the unit comes from like a donor with high level of lead. And we know that the brain goes under a significant amount of development after birth in this group of recipients, and also lead can constantly compete with iron, zinc, and calcium in their vital roles. Our body doesn't have a way of clearing lead. It just accumulates and it remains in like a dynamic equilibrium among bone, blood, and soft tissues. So we were curious to learn about the levels of lead in our donor population in Canada. Samples, whole blood samples from around 2,500 donors came to our lab, and we used mass spec to measure the lead levels in them. We included all the permanent clinics across Canada, and also we oversampled the centers that had the potential for higher level of lead. And for that, we looked at the sources for lead, where we are exposed. And because we were not actively recruiting these donors, we didn't have any information about their jobs or hobbies, and we could only focus on like mines and also lead in water. And for that, this is the map. We have a few lead-producing mines in Canada, in British Columbia, and also in New Brunswick and Nova Scotia. And for lead in water, you might remember the news in 2019 from actually a work done by journalists who they were sampling water across Canada to find about like the lead level. It could give us some hints about where to sample. Also, there is this study by BC CDC that shows us ethnicity has a role too. So this is the result. Here in this table, you can see the range, geometric mean, and percentiles for BLL. BLL is blood lead level, but I'd like to focus more on the number of the samples above certain thresholds, like on the right of the column. And in bracket, you can see the percentage of the samples above that threshold. So these thresholds, 10, is the intervention level in Canada for adults, and 5 is the level that the threshold that CDC encourages we start investigating what is the source of exposure and preventing it. And 3.1 is the level that has been calculated in literature as the maximum level that can be safely transfused to pediatric patients. So what are the predictors of blood lead level? Male donations had significantly higher level of lead compared to the female donations in the top table. And also there was a positive correlation between age and blood lead level, and age could explain 17% of the variation in BLL. Also, we could see a significant but weak correlation between the hemoglobin total level of the unit and the sample and the BLL, as most of the lead is stored in hemoglobin. And then last, the role of the centers. So this is the way I have put the data. Probably there is a better way, but like for now, this is the list of all centers that we measure and the distribution of lead in that center. And then on the left of the graph, you can see the name of provinces. And there is a line at 1, so any center that you see, the median is above 1. There are centers that on average have a higher lead level. And we have centers marked with A that have significantly higher lead levels compared to the other centers that are marked with B. So this table on top right summarizes the significant differences between centers, and the centers with high levels of lead are listed on top, and you can see that Campbell River and Bathurst, these are two collection centers closest to the lead-producing mines, appeared in top list. Also, we have Moncton and Comox Valley appeared on this list that are not like far from these mining centers. So the geographic location of the centers matter, proximity to mines matter, and you can see from this data that we do have some units with relatively high level of lead. And what we can do with this data, measuring like lead or any heavy metals before neonatal transfusion is practically impossible. So maybe what we can do is to reduce the risk of transfusing a unit with high level of lead, and with putting some selection criteria. Age can be one criteria. This is the approach that Hema-Quebec took, that they use the blood from young donors for transfusion to neonates, or for Canadian Blood Services purpose, we can at least prevent this blood from the centers that are close to our lead-producing mines. And that was the lead research. Thanks so much to Dana, our incredible team in the lab, our collaborators, funding, and thank you for your attention.
Thanks, Narges. Questions?
That was a nice talk, thank you. I was wondering, do you think that the fact that you see more lead in older samples is bioaccumulation over time?
Exactly, it is bioaccumulation.
Okay, thanks.
I think we also know that it has to do with where you live, because if you look at the lead levels in the water supply in downtown Toronto, they're very high, and it's because they just haven't replaced the lead pipes.
Congratulations, great work. And
Thank you.
following up on the point from Dana, I don't know if you measure mercury as well, but it would be really, yeah. So do you see differences, for example, in coastal regions that have access to seafood rather than like central regions
Exactly.
in respect to levels of mercury?
Yes, I can share the data with you, the table. We had way more like significant differences among centers, but what was striking was our centers in Alberta had significantly lower levels compared to British Columbia, all centers in British Columbia, and also maritime. So yes, it was like significant that the coastal area had higher mercury level.
Thanks so much, great work.
Yeah, thank you.
Are they doing this research around the world, checking heavy metals in blood? Because I was just interested in, I've been reading about cilantro, that it's a natural heavy metal chelator, and wondering if countries that eat more cilantro, you might find lower levels.
That is interesting. I will look into it.
Okay. Thank you, Narges.